we are well, you know, as mentally, spiritually, physically, we're better able to care for and connect with our patients.
Welcome to the We Are Human podcast that dives deep into the lives of those who work in healthcare but do not let healthcare define them.
So every week we bring on healthcare professionals to share their stories, their victories, but also, their struggles, their woes, the things that get them through the day, and most importantly, the things that keep them human, both in and outside of the hospital.
Because while medicine is a big part of what we do, it is not all of who we are. So welcome to We Are Human.
And I cannot think of anyone better exemplifying that day in, day out than Laura. Laura, I feel like I talk about you at least once a day in residency. If people don't already know who you are, like I feel like we'll go into everything that she does, which is incredible. But like every single time you've got a new block up on Instagram, I feel like you are listening to the conversation that we were having in the workroom the second you posted that. I swear, it's like 5 minutes after. Oh, okay, she was obviously in the workroom. But I agree with Tommy completely. That is like a sound of peace that is getting so many people through healthcare right now.
That's so kind. I think I'm trying to share with others a message of encouragement and truly of peace, that you are not alone in what you face. A lot of what we face as healthcare professionals, especially, there's a lot of shame associated with things we face and a lot of isolation. So a big part of my goal in my career and in my life is to help people feel less isolated in what they're facing, and also to make the field of medicine more human, both for patients, but also for all clinicians.
Amen. I love that.
I'm so sorry. I'm going to cut over him again. You go ahead, Tommy. Go for it.
I was gonna say, amen. I love that. And Laura, before we dive deep into, everything that we have to talk about today, could you just tell our listeners a little bit about yourself, what specialty you do, and kind of like your goals and passions in medicine?
Yep. So I am an oncologist, a medical oncologist. I did internal medicine training and then medical, hem-onc training. And now I focus my practice on gastrointestinal cancer. So primarily patients that have pancreatic, liver, colorectal tumors. And so my work as an oncologist is very, very meaningful. I get to know my patients really well. I'm seeing them every 2, 3, 4 weeks. And 80% of my patients actually pass from their illnesses. So a lot of the work that I do is caring about people from the moment of diagnosis, guiding them through those really, really hard things, developing these really deep relationships with them and their families, and then actually walking them through end-of-life care. So I love my job. I love that I get to serve that role for my patients, but of course it comes with its own challenges. So that's my clinical work. I'm also, like Tyler, a writer. Tyler and I have been encouraging each other in writing for a very long time. I was like a secret writer for like 5 years before I even told my mentor. So a lot of this was journaling and then narrative essays. And then I got an idea for a novel when my daughter was literally 2 months old. Like, God, why this timing, right? And so my novel has kind of slow and steady, and I'm still not, Tyler and I have gone through this a lot, but still writing is really the core of who I am, both in my academic career. So I'm a professor. I have an academic career at the Indiana University School of Medicine, and I kind of have a few other hats that I wear. I run a narrative writing program here on campus. I'm now going to be on an editorial board for Journal of Clinical Oncology, Narrative Medicine. I get to give some cool talks. I've gotten to give some commencements and a TEDx and some cool things like that. And I wear a few other hats on campus on like wellness committees and a leadership essentially academy. So lots of cool things that I get to do.
Goosebumps, literal goosebumps. Like I said this to Laura when I first got in contact with you when I was doing some stories around people in medicine, and Laura was the first time I had met anyone or heard of anyone that was doing what I was trying to describe what I wanted out of life, but I couldn't put a name to it because it wasn't a thing. So I would just tell people, oh yeah, I really like writing fiction. I also want to be a doctor. I know that's not really a thing that you can do together. So I'll eventually pick one or figure out maybe something that is a nice middle ground. And then when I came across what Laura was doing, I was like, really? No, that just looks like I want to do what she's doing. It's perfect. Whatever the name of that is, it's everything under the sun. And so I've just been like, you've been a huge role model for me, not just like starting into medicine, but also keeping the writing alive. I'd love to know, and I think the listeners would really love to know, for when you started writing, I know we're talking about like right now you're working on this novel that's been going on for a while too, but you do a lot of other writing projects with narrative med and outside. When did the writing really start to pick up from maybe hobby to less so?
I started writing when I was a medical student. I really encourage anyone who's listening here to think about writing almost like a therapeutic tool in your toolkit to help you process and cope with the challenging things you witness. So when I was a medical student, I actually wrote to just process and cope with what I faced. I was actually a pregnant medical student in my third year, and I was on the high-risk maternal fetal medicine ward, and I was working an overnight shift as a medical student, and I saw this woman that had gone through all these infertility treatments, and her husband was sitting beside her, and she had lost her child. The child had unfortunately died, and so they were going through the process of birthing this child that unfortunately had died. And I remember as this medical student, right, we as students, we stand there, we're really passive, we're these observers. So I'm standing there with like my scrubs and my white coat over my abdomen, and the child that had died was about the same age that my daughter was inside my womb. And I was this medical student just trying to be as supportive as I could be, but also not trying to make it about me. And so I watched this family. I thought about, had they painted the wall of their nursery? Had they put together the crib? Had they picked out names, right? This life that they were planning for that all of a sudden is no longer there. Just how devastating that was to witness. And then I walked out. It was the night, Tyler, you just got out of a night shift. I walked out, right? And it was 3 a.m. And all of a sudden, I'm no longer this passive medical student. I'm this woman who's carrying this child. And all of these emotions just overwhelmed me. And I just started crying. And I thought, as I'm driving home in the middle of the night, I thought, I have to find a way to process through these difficult things that I experience witnessing illness, trauma, death, all of these things that we witness as clinicians. And so that's really when I started writing. It was just for me. It was, this concept of what we call in narrative medicine of the parallel chart of certain patients are going to evoke certain emotions in us, and that can't go in the medical chart, but it needs to go somewhere, right? So this idea of this chart, that's a journal, that's of course HIPAA compliant, no details. We're not in any way putting things that could be identifiable, but we are processing through this hard thing that has happened. And that's what I started doing. So I did that on that rotation. And then I did it again when I was going through my surgical block and a patient unexpectedly died on the operating table. And then again, when I was a new mother, and then again, when I was an intern, and I just kept journaling. And for a long time, that's all that my writing was. It was just a way for me to come to the page to process through these things that I was experiencing. And it was very therapeutic. And it really wasn't until I was a resident. I would say I was really, in late intern year, early second year when I started seeing things on, some of my friends were like, oh, join this writing group. I'm like, oh, what's a writing group? So it was really the first writing group that I ever joined was when I was a second year resident. And so we wrote together, we shared together, and then there was this encouragement to take some of our writing, shape it into an essay, really more of like what we think of like a narrative medicine essay, and then maybe even have the courage of, can we even try to publish this? Because, there are other people that may benefit from what we're reading. They may have had similar experiences that they're kind of holding in, and maybe our sharing can help them process through those. And so that's really how writing for me transitioned from this thing I just did by myself then to something that I did within writing groups, and then eventually going on to publish essays. And then, of course, my fiction writing is, like Tyler, you also write fiction, you also do both. And so fiction, of course, it's a beautiful, complex, wonderful thing, like a puzzle to write a novel. And it takes a lot of intention and effort and focus over time. And so it's satisfying to me to have both of those pieces of those short essays that can be written and published and shared, but also to have some longer form. And so that has been how my writing has developed. And now, of course, I'm part of I think 4 different writing groups now. I'm part of a group at Stanford University. They're Pegasus Physician Writers. I'm part of a women physician group at Harvard now, which has been fantastic. I lead a group here on campus, and I've participated in like the Gold Humanism has a writing group. For anyone listening, that's also a great option to kind of get into writing. And I also have a writing coach. And so that's a big part of me just trying to, I think about it like the slow and steady train of like, I'm just chugging along real slow, but I think consistency is what matters.
Ah.
Yeah.
Oh, that's my only response to all of that. Oh my gosh.
Oh
That's
my gosh.
incredible.
Yeah, I think
Um,
it's so powerful that um, medicine's hard, and our patients suffer a lot. And we also suffer a lot as we go through that suffering with them and kind of are there to help them through that suffering. And I think it's so incredible that you found a way to cope through that suffering through something that fulfills you and something that helps you kind of decompress for all that through all of that. And it's so because as you were speaking, I was like, how can I relate to Laura in this? And because I actually just started writing, but for me, everything you were saying is like exactly what I do through like the physical fitness stuff I do. And so I think it's so incredible that you have found a way to cope through that through writing. And what's so powerful, I think, about writing is that you can go back and reflect on those memories and those stories as you just did telling us about them.
Yeah, thank you. I love that you found fitness as your outlet. I think for all of us, it's different. And I think for many of us, it's not just one thing, right? For me,
Yeah.
being in nature is very therapeutic. So if I'm having a hard day, going for a walk outside, going for a hike, just sitting outside, honestly, is very therapeutic. Listening to music. When my daughter was born, I actually started meditating, and it's really more of a combination of like meditation and prayer, honestly, more of like a meditative prayer. So it's my faith, but it's also, right, this true practice of meditation that can be helpful to stop spiraling of negative emotions. It can help with kind of radical acceptance when you're on call in the middle of the night and you don't know when you're going to be paged again. And I think that there are other things that I've also reached for. For me, reading fiction, especially audiobooks, is very helpful for me to at least have some temporary respite from some of the challenges that I face. And so I think we all can reach for different tools that can help us cope, but those are some of the things that have helped me. And then, of course, physical fitness for me, doing things like Pilates and yoga and hiking for me, those have been kind of the other therapeutic things that have been helpful.
I really wanted to get the listeners to know when that had transitioned sort of from hobby for the I'd say for the sole purpose of that, this wasn't something that you went out with the intention of, this is the end product that I want from all of this. I think a lot of times when um, people that are in medicine are seeing people that do anything outside, we only hear about often those that do things outside of medicine because they've gotten some accolade associated with it, or, it's something that is very producible. Um, and I have always said that I don't think that there is anything different or anything greater or stronger of writing a book versus writing in a journal. I really don't see the difference as far as the benefit that you get out of it. Um, and I think for anyone out there who's listening who's maybe contemplated journaling or maybe they've never written anything in their life, I can say that if you start journaling, it certainly can be a very uncomfortable experience to start, especially if you're not used to kind of thinking that introspectively. Um, and I would just like to stress that everything that you're thinking when you're journaling, um, do it for yourself. Everything that comes up, there's no judgment because the only one that's hearing these things is you. And the things that you're maybe scared to put on paper or worried that maybe people would, um, maybe judge you for, that's the exact kind of thing that needs to go on the paper. And then you'll be surprised where it goes from there. Like Laura said, there's so much therapy and peace in just the act of putting thoughts and words to page. Um, I was even thinking about that from this night ship I'm just getting off of. Like, we had we had a lot of a similar situation happen that was pretty tragic, but like after the third time, then the fourth time, and then the fifth time with different patients, if I didn't find a way to get that out in the moment, or we all have versions of debriefing, but just, for me, the way I personally choose to is through journaling. That can stack up over a career. I know y'all are the intendings here. I'm just the intern, but I can already see like, that's one night. So you compound that over 10, 20 years and just it can take a toll if you don't find a way to cope with it.
Yeah, that's very well said. I do think that something about having a process that helps you to slow down and reflect in some way, whatever that looks like for you. I think it really helps you to hold on to your patients as human beings, because we do see so many patients and they do experience really, really hard things. And we also experience compassion fatigue, right? Which is both the emotional and the physical exhaustion of caring for people that are going through really hard things like trauma and illness and death. And that can take a toll on us. And if we don't regularly have what I like to think of space in the margins, right, on both sides of our day and throughout our day to help us slow down, whatever that looks like, that we all will have experienced compassion fatigue. I've definitely felt it multiple times in my both training life and my faculty career. And so whenever I'm experiencing that compassion fatigue, I try, if I can, to just find small moments in the margin, just driving home with a little bit of silence and processing through, or journaling, or prayer, or going for a walk. Whatever it is, those things can help you to recenter and reconnect with your humanity.
Yeah, Laura,
I'm
I think
so
it's
glad. Oh, you go ahead.
Oh, go. I think we're gonna say the same thing, Tyler. Like, I think Tyler and we're both gonna say that we're so grateful that you said that, because it is so important. And as you're a medical student, an intern, resident, or even an attending, you're gonna see a lot of trauma frequently, and it could lead you to having compassion fatigue or just feeling numb about the situation and not having the same empathy or the same compassion that you had for the patients previously. And so I think it's so important to find a way to decompress from that, because the last thing we can do as physicians is to not allow our patients to be human. Because I think when we do that, we lose our true strength as physicians. And so I think it's so incredibly important what you said about the space within the margins and taking that time to be able to come back to a place where you can give the needed compassion to your patients and be there for them and experience the suffering with them, to let them know that we do see them as human and not just another patient that is going through something that we've seen 1,000 times.
Yeah, I've heard the analogy used of, you think about when you're building a fire, you have, the logs and the sticks and the kindling and all of that. But if you don't have air around that fire and within that fire, the fire's not going to burn, right? So the air is like the space in the margin. If you do not have that room in the margin and all of those things are just stacked up upon one another, it's really impossible to function as a human being.
I'm really glad the concept of compassion fatigue came up today because, as you know, I just wrapped up with that program, that media medicine program, and one of my favorite lectures we had from there talked about how do we combat compassion fatigue from a writing standpoint, and both from narrative and from fiction. But they showed all these examples about how you can show 100,000 people died of XYZ, or you'll look at another New York Times segment of this is the 20th occurrence this month of insert tragedy. And I mean, we have become so numb to that, not just in medicine, but just in all kinds of forms of media. And then they showed examples of, all right, well, you can take the 100,000 or you can find the one and the 100,000, because the 100,000 goes in one ear, out the other. But if we can highlight one of the 100,000 to where the reader or the viewer can see themselves in that one, then only then can they really start to grapple with the weight of the 100,000. And I was thinking about you when that lesson was going on, because I've just started working in the realm of narrative med, because I mainly do fiction, but you definitely have a foot in so many different writing camps. So when it comes to that aspect of compassion fatigue, is that something that you think about when you are writing? Do you think about, like, depending on the media of nonfiction and fiction, do you try to keep things more broad? Do you try to highlight the one and the many?
Yeah, that's a great question. We do know that when we hear a story, a different part of our brain is activated than when we hear data. So storytelling really is powerful. And we're talking about this here on our campus, part of a leadership academy. And we're really thinking about how does storytelling move people, and how can we use that as a tool, both of course to educate people online, but also when you're applying for a grant, or you're trying to you want to do a screening program for colorectal cancer, you want to raise awareness. How do you get foundation funding for something like that? But even more importantly, how do you help people to have compassion within medicine. And we know that when you read fiction, that you have high levels of empathy toward a person that you can then identify with. And that is true of even short stories. And so that's a great question, Tyler. How have I used that in my practice? A lot of my narrative writing is really kind of my own processing of hard things as a clinician. But I am starting to explore that now that I am leading some of these programs, like a young onset colorectal cancer program. And I want to increase screening among young people for colorectal cancer. And how do I get funding for that, right? And so that's something that I'm really thinking about, of course, with permission, with the patient that gives you then, and many of my patients are like, yes, please use my story. If there's anything that you can use that will help another person, please do that. So I do think there is a lot of power in telling a story for whatever reason that is, with permission for grant funding or for foundational funding, or even just to help a person to connect better with a person that's going through something really hard.
Yeah, I think, Laura, I think your writing has been so instrumental, not only from like your own success in medicine and just how you deal with everything, but also in your social media life. I know that your writing literally benefits hundreds of thousands of people every single day. And it has been so incredible to see you evolve over the past few years that I've been following your journey. And I love it. Is it okay if I ask you a personal question?
Sure.
And it probably ties into your writing?
Sure.
So you told us, Ari, some very deep stuff about how when you were pregnant, I believe it was with your first child in medical school, and had that really hard experience with a patient that lost their child. But with that, I feel like a lot of us in medicine deal with some really hard times that make us question if we truly want to go forward with medicine or even stay in medicine. Did you have any times where you questioned if you wanted to become a physician? And if so, without breaking HIPAA, of course, what were those moments? And then would you say that writing helped rescue you through those events?
Yeah. So I think if both physicians are being honest, all clinicians, nurse practitioners, PAs, nurses, I think that we go through periods. Sometimes it's once a month, sometimes it's once a year, sometimes it's once a day, where we say, oh my gosh, is this really worth it? Because it's really, really hard to practice medicine, especially when, for me, I have a window of, if there's a new patient that needs to see me for cancer, it's like we have to get them in as quickly as we humanly can, right? And so my clinic days have evolved, right? I'm entering now into my 4th year of practice as a faculty. Have gone from, being not that many patients now to I have many, many patients that need to see me. And I can't really say, oh, I just want to see fewer patients, because these patients need treatment and they need to be seen, and they need to be seen quickly, right? And I think we all want to care for patients, but we also need to care for ourselves and have space in that margin. And so I think the two factors that, and for most clinicians, the two factors that make me kind of hit the pause button and ask, is this worth it, right? Number one, when you're facing extreme exhaustion. So if you're sleep deprived in your training or your practice, you're on call a lot in your training or your practice, and you are just physically and emotionally exhausted. Because we know that's true, that when Tyler's facing this right now, right? When you are exhausted, your brain just doesn't work as well, right? You can't problem solve. Your anger, you have a shorter fuse. You're more likely to be impatient or to be angry. You actually have lower levels of compassion, right? So your empathy fades. And so I think when we as physicians are exhausted, and I, of course, talk a lot about this on the advocacy work that I do, that sleep deprivation is not a good tool for learning, and it's not a great tool for taking good care of patients on a daily basis. So the times in my life when I have been deeply sleep deprived, both in my residency and fellowship, talking like 100 hours, basically 100 hours awake straight, those have been the times where I'm like,
gosh.
I don't know if I can I'm hallucinating. I'm like seeing like these like black circular figures like climbing up the white wall as I'm like walking into the ER, and I'm like, I don't think this is right. What's happening here, And so sleep deprivation, every time I've experienced, I've definitely been like, whoa, is this really worth it? And the second thing too is when you feel like we're all going to experience this as clinicians, when a patient is angry with you. Maybe it has nothing to do with you. Maybe they wanted to be in sooner. Maybe they're frustrated that the cancer wasn't found quicker. Maybe they are just angry, right? And so when you are on the other side of that anger and you're sitting there and you're doing everything you can to listen empathetically, and yet when you face that, you say to yourself, you're like, gosh, our patients go through so much, and we have to meet them where they are and recognize that a lot of times their emotions are a reflection of what they're facing, and it has nothing to do with us. But I think that when you're facing either deep exhaustion or feeling like your work is either it's either too much or you feel unappreciated or even have anger directed at you, I think those are the times that we pause and we say, gosh, is this worth it? And I think if any clinician is being honest with you, they experience that thought. And maybe the third thing I'll throw in is like when you're inundated with like modules and recertifications and all the
Oh my
paperwork hassles
gosh.
that go with medicine, and you're like, oh my gosh, is this really worth it? But and then you'll have a day where it's like you get to see these people that you love. I mean, truly, like your heart, you're just like, when you see them, you just could spend like the whole day with them and you just love them and you care for them and you want to be there for them. And you're like, you have a really meaningful day where you're really helping people and it's joyful. And even when people have cancer, they're like laughing and telling jokes, and not that that is the expectation. But then you have days like that and you're like, oh my gosh, I don't think there's a better career in the world. Like, how lucky am I? This is like sacred work and I love what I'm doing. So I think we all kind of ebb and flow from those moments. I don't know about, Tyler, Tommy, if you experience that. I experienced that probably on like a near weekly basis like that. But overall, I still continue to find that this is the most meaningful career and the work that I'm meant to be doing.
Yeah, I think I probably went back and forth from that 6 times tonight. Yeah, no, um, no. As we're
Right?
rounding out intern year, no,
Oh
I
man.
so I couldn't agree more. I often say it's a godsend, God moment of my life having this medical leave during med school. And I was so shocked when the med leave started. The response I was getting from most people was, oh, maybe you probably won't have to go back now, or like because like the book stuff started picking up, and um there was a lot of stuff. Oh, like now you've gotten out. There's like almost it was almost like, oh, freedom, and I was like, wow, I really hope that's not how I feel because I haven't even started yet, but I finally got the opportunity to start this path. And even as great as it was to not have to do med school every day for that year. There's some, joys to that. I found myself so often petrified at the thought that I wasn't going to be able to get back. Like that this med leave wouldn't be just a year, that it would be longer and that I wouldn't be able to see patients again. Which is also why, like, when I get asked, what do you want to do out of medicine in life? And I couldn't see myself only seeing patients and not being able to write, but also only writing and not being able to see patients. I think that's where I feel really blessed to have something outside of my life like writing that for those moments like you talk about. I think if I didn't have that, I I don't think I would be handling a lot of intern year very well, let alone like a lot of the struggles that we've gone through. Even more important for us to dive into things like this. Tommy, I know you Tommy, by the way, I think we said at the beginning, but I don't know if it got cut. Tommy, I'm tired coming off of I'm straight out of the hospital of like a 14-hour shift overnight, but Tommy is just coming off a marathon, so I probably shouldn't complain about being tired. Let's go.
Oh yeah. Tyler, you said so. Actually, Laura and Tyler, you guys just said so many things that I have to just talk about. So first, like Laura, I think that the three things that you listed are so important, and Tyler, you are at the crux of facing all of those, which is insane right now, right? Like sleep deprivation, you just came off a night shift. I'm feeling underappreciated. You're an intern, and then like all of the paperwork that is just like it's just insane how much we have, but a lot of that is like intern year, which you just did. And so I think it'd be so helpful to the like for all the listeners to like, how in the world are you staying well? Like, how are you getting through? How are you not having compassion fatigue? How are you not feeling burnt out? How do you not want to quit medicine right now? When I mean, Laura and I, we're kind of like on the other side, but like you are literally in the midst of the fire right now. And I think you kind of alluded to it, and a lot of that is your writing, but like right now in the crux of it, like how are you doing it?
I mean, I appreciate it. I honestly, it it really does come down to being, I think, at the right program too. Um, I feel really blessed to be at a place where I feel like my co-residents are family. That if if something were to happen to me in the blink of an eye, I can think of 5, 6 people that wouldn't even hesitate, drop what they're doing, and come like that. That's pretty special, and that I know not everyone gets to experience residency with that kind of support system. So that in itself is is massively impactful. Um, but no, actually, even we think about future planning and writing. One of my advisors, so the person who actually interviewed me for my program, is also a writer on the side. That's kind of like a connection that we had. And so when I came into the program and we had our first advising session, they they brought up all these very specific things that I had mentioned in my interview day, which I was just touched that they remembered all those,
They
but let
remembered
alone
right.
Wow.
no, they had him written down like, hey, so do you still want to do these things in residency? Like, I know this writing thing you talked. I was like, yes, if that is possible. But um, we made a promise to each other to keep each other accountable from the writing standpoint. And so even like I was in the emergency department last month, I ran into her like precepting and she was like, have you written anything this week? I was like, yeah, you. And we like talked about what we were writing. It's little things like that. I feel um keep if you are in a support system that hopefully can encourage those things, but even if that's not like those humanistic elements maybe people are interested in pursuing but they haven't been exposed to, if you can help expose them to it and collaborate that, I think everyone's just better off for it. So that's what I'm hoping to do with my intern class, and I think we've done a pretty good job of it so far.
That's incredible. I feel the exact same way. So where I work, it is truly the most incredible environment. I was literally in tears running the Boston Marathon yesterday because so many of my faculty members, so many of the nurses I work with, the respiratory therapists, they were lining the course, just like screaming their heads off, cheering for me. And it just made me feel so appreciative that they care enough about me to go out on a Monday and spend their day out there, and obviously they weren't there just for me. Our child life specialist ran. She is a rock star. I love her to death. One of our nurses ran. It was an incredible day, but that support is so, so special. And I think that is so important. And Laura, something that you said that I think is so important to highlight is what a great honor and privilege it is to be a physician. Like we think of all of these sacrifices and things that make us feel like it's not worth it. But at the end of the day, if we really think about the honor and privilege it is to hold a family member's hand when their loved one's passing away, or hold our patient's hand when we're telling them they have a new diagnosis of cancer, like, yeah, those could be hard moments, but what an honor and privilege it is to have that. And what a shame it would be if we allowed those other things to get in the way of seeing how wonderful it is to be a physician. And I think something that I say often is that our passions outside of medicine keep alive our passions for medicine. And I think a lot of that's what we've been highlighting is like with you guys writing, that allows you to go back to the hospital or the workplace to, give everything you have to your patients. Me running the Boston Marathon yesterday, like I'm jacked out of my face to go to the hospital tomorrow to love on my patients because like my cup is literally overflowing right now. Um, but that's kind of like how I see things and what I think helps prevent compassion fatigue and burnout, maybe.
Yes, I truly believe that when we are well, you know, as mentally, spiritually, physically, we're better able to care for and connect with our patients. And so I really do think that we have a duty to take care of ourselves as best as we can within the limits that are sometimes set by the environments that we are in. And the more that we can take care of ourselves and find some type of outlet to give us space in the margin, I really believe that that protects our longevity and our careers, that we're less likely to leave the field of medicine, because I try really hard to help. I am the privilege of getting to have a lot of medical students. Almost every single day I have a medical student, resident, and fellow in my clinic, usually all three. And my goal is to train good doctors, but give them tools to be able to keep a foot in the field of medicine and to find a career that is the right career for them, even if that career looks different, even if that means that they are, they're an athlete like you, Tommy, or if they're writing, or if they're thrilled to do this other aspect that seems to not align at all with their clinical work, and finding what is that meaningful work within our career and outside of our career. I think that helps protect our ability to do this work.
I couldn't agree more. And I do feel like I should add on for as far as getting through intern year, so to speak, like the things like how are you able to stay human in the times that you can't write and all. I think it shouldn't go without saying that we spend so much time and so much focusing on the negatives, focusing on when bad things happen. Like you debrief after a bad scenario, or you go see your co-interns after a hard shift, and everyone just kind of like unwinds on, I can't believe all this happened. Like that's the way we're hardwired. And we spend very little time practicing sharing the positives. So I think if I'm being completely honest, things that do keep me sane and apart from writing or apart from my friends, is like seeing people like you guys doing what you're doing, and when watching people do things that put their souls on fire, it's hard for your soul not to get a little bit of that spark. Like I look, man, I don't think I ever truly want to run a marathon, but I will never get tired of seeing the joy that it brings your face. And so even on my shift last night, when I am just exhausted and I pulled up to see, I wonder if like Tommy has showed anything from it. I could see like the smile you posted with Oliver. I was like, that's what it's all about. So like, you know, it's you we talk about on the last episode too, kind of the not the flack, but like the cautions of posting your life on social media. And but when you are showing genuinely who you are and unapologetically yourself, know that there are people that maybe just need that day to see, like, I needed to see someone going through something good that day, and I'm glad that they're having a good day too.
Yeah, Tyler, you said something that made me think of a question that I ask on rounds all the time. So, if the listeners don't know, I'm an academic hospitalist and I step down from the ICU. And so I get to lead rounds, which is something I thoroughly enjoy. And so when we round, we have the nurses, we have the pharmacists, we have the RT, the medical students, the residents, and it's just a really, really good time. And so something I like to ask is, tell me a time in medicine that reminded you why you wanted to be a nurse or reminded you why you wanted to be a doctor. And so why not ask you guys? And so Laura, could you tell us a time in medicine, obviously without breaking HIPAA, we'll probably say that 1,000 times, but it may be a patient encounter that reminded you why you wanted to be a doctor, even if it was in the midst of being pregnant, 100-hour work week or whatever it was, that moment you're like, this is why it's all worth it.
I will tell you a story from yesterday from a patient who is
Love
already
it.
like, please write about me, please share about me, please use my name. So this patient is a lovely 84-year-old male, and I've gotten to see him probably every 2 to 4 weeks for the last 8 or 9 months of his life. And he had surgery for his pancreatic cancer, and I treated him with chemo after that. And he has had I will just say lots of ups and downs, lots of ups and downs. But he is the most wise person that I've ever met. And he always, every time I ask him how he is, he says, I am better than those not as well. Meaning that he has this insight that, yeah, he's facing this, he's on chemo, he's dealing with pancreas cancer, but he is still better than many people who have it worse than him. So he already has this gratitude. And so, I was on call last week and I was pretty sleep deprived at some moments overnight. And when I can't fall back asleep, I do these meditations. And I kept thinking about this patient and I kept saying, I'm better than those not as well. Out of this gratitude of thinking, my goodness, yes, I'm experiencing something that's hard, but I'm praying for those that are not as well. And I'm grateful that I get these. Every single page is going to be a person that is going through a really hard situation. Right. And so yesterday I was in clinic and I told him this and I got to see him and I said, I was thinking about you last week and I was thinking about this, and he's a strong person of faith. And and then we just started, was tearing up, and then he grabbed my hand and started holding my hand. And of course, we talked about how much, we enjoy getting to see one another. And it's moments like that, or it's moments where you get to really know people. And I've had many, many experiences with people through the ups and downs of their illness where I really get to know them. I get to know deep details about their family and their personal lives and about them as a person. And that is what makes me want to keep doing this work, is getting to know people as human beings beyond their illness and getting to be there, taking, thankfully, all of this knowledge that I've been so lucky to be able to acquire and experience, and being able to take that high level of complexity and break it down into ways that people can process and to help them make the next best decision that's the right thing for them. And I do think that is just what makes all this work worthwhile.
I love that
Beautiful.
so much. Yeah, I'm a big baby. I'm gonna start crying.
But what beautiful insight too to share. Like, I'm always amazed by how different patients handle different severities, and I'll say it again, in different ways, like that. Um, someone of their stature, of their history, to be able to say, I'm doing better than those that are doing worse off, at least, like to have that cognizance. I mean, that's just, I mean, that's inspirational.
Yeah, and I think it's something
Dude,
that like all resident physicians or attendings like we could use every day as well. Like, yeah,
Yeah.
we're going through the hell, we're going through the hell of residency, but like I am so much better than those that are not as well, right? Like that is just such, yeah, like you said, Laura, such a wise, just a one-liner, and I'm sure such a wise man as well. So Tyler, I'm not letting you off the hook. Your intern year, can you remind us of a time that helped you remember why medicine was worth it and why you wanted to be a doctor?
I mean, I'll carry Laura's theme of doing something recently.
Yeah.
So I feel like from this last shift, if we're gonna talk about this night shift, I feel like sometimes night shifts or ED shifts tend to have a theme. Like whether you're just very cognizant of it, it's like, oh, everything this night was gallstones, or everything this night was what. Well, everything last night was seizures. I don't even know. I think by the end of the night we probably admitted 7 new onset seizures alone, and then other people had seizures as well. It was a seizure night. Um, and for the most part, a lot of the true seizures that occurred were with families that were aware of their seizure disorder or their epilepsy. So like the actual act of the seizure was not too much of a shock to see or witness. Um, but we talk about also compassion fatigue. My very, very last admit of the night is a possible concern for a seizure. Like we were almost joking in our head, like, oh, it's probably not actually a seizure, but we're just, trying to think it. And, we walk into the room and kids like waving hi and then suddenly start seizing. Like it, and then immediately like GTC and mom, I'm not even paying attention to mom because I'm trying to make sure that, kids taken care of, and we're getting in orders because we don't even have admit orders, all that stuff, the chaos of when someone just comes in through the door. Um, and in my head, I was like, oh, here we go again. And by the end of it, we get them nice and settled. And I look over at mom, who is just in hysterics. She's like, hasn't seen their child ever act this way before. And, you know, I, I snap and go back over to mom and like walk her through everything that happened. Me and my senior talk through what like the scary things that we think it is not, and why we believe it is not those scary things, versus like the unknowns that we are working on getting answers. But most importantly, to assure that at just a given moment, very, very stable, okay, she's resting, like nothing to be concerned of. Um, and then watching the sigh of relief, and then watching the, oh, okay. And it's the, not the knowledge of what my diagnosis is, but being given knowledge of just why this scary thing looked the way that it did. That is more powerful often than just getting to the end of the tunnel, because I feel like so many times we take for granted being able to understand the mechanisms of any kind of diagnosis, and to share a little bit of that comfort, to have understanding over it, giving you a little control over that. And here I was all night just thinking like, oh my gosh, I can't believe this is my eighth night seizure. And then this was this mom's first ever in their child. That's the reminder of like, no matter how many times it might be the millionth time for you, like this is often like the first time for them.
Yeah, and Tyler, I think you highlighted something that is so important is in the midst of compassion fatigue, do not sacrifice the one thing that'll reduce that compassion fatigue. And so what I mean by that is like you could have very easily went in through an order, said, Mom, we're gonna take care of your kiddo. I'll come back and see you later. Walked out, did the admission and be done with it. And then the day team would have taken on everything else. But the thing that will reduce, I believe, your compassion fatigue the most is having that moment that give you the reward of why you became a physician to begin with. And that is talking to the mom, holding her hand, talking to her, like helping reassure her, helping her feel loved and comforted and well cared for. And even in the midst of your compassion fatigue, by you taking that extra time to do that, I think not only did it help the parent considerably, but probably helped your wellness in terms of that night shift and how it was going as well.
Yeah, it's that human connection, right? That's the moment that makes it worthwhile, is the moment where you take that extra step to truly connect.
Yeah.
How about you, Tommy? What you got?
I thought since it was my question, I didn't think I had to answer.
No, you don't get to escape.
Yeah, I will share one. So I do adult medicine and pediatric medicine, and so this is with an adult patient that I had. And this patient, as a hospitalist, we do 7 days on and 7 days off. And so a lot of times people think that you cannot really get a good connection with that patient. But I firmly believe that if you treat your patients as human, whether you see them one time or 1,000 times, you can have an eternal impact on them. And it's how you approach that encounter to whether that impact will be good or bad. And so even though I was only with this patient for 6 days, we became very, very close. And so this patient unfortunately was nearing the end of their life and was in like very elderly and had been married to their spouse for an extremely long time. And like I said, over that week, I'd grown very, very close with them. And um, towards the end of their life, I had a conversation with the family. We were all in the room and the patient was in there, and I had told them like I believe that we only have minutes to maybe hours left before we pass away, and um, if there's anything that I could do to make this time better for you guys, please let me know. And they were a family of faith, and so I was able to help them and pray with them and things of that nature as well. And right as I was about to leave, the patient, who I didn't think would be able to talk to me, called me to their bedside and asked me to hold their hand and asked their spouse to come over there. And the three of us were standing, or the patient was laying there, and the spouse and I were standing there. We were all three holding hands, and the patient had said, "Tommy, you see my spouse here. We've been together for over 40 years, and I want you to know that they're the most incredible person in the world, and 40 years isn't long enough. I know that I'm going to be leaving soon, but I want to leave you with this, and that is the beautiful wife that you have and the child. Cherish them every second, because even if you're married to them for 40 years or more, it'll never be enough." And just to have that moment and to get to share in those last moments was so impactful and so meaningful. And I truly believe that that patient helped me more than I probably ever helped them and their family, because it just really made me reflect and be like, I need to cherish my wife and my children every single day. Because even if I'm married to my beautiful wife for 100 years, it's not going to be enough. And so I think moments like that just really, it made all the paperwork that I had to do that day. It made all the social work meetings or all those things seem so meaningless, because of the honor and privilege it was to have that one moment with the patient.
That's beautiful.
Yeah.
Wow.
So Laura, you do writing, but you're also a mom and a wife. Can you tell us, dive a little bit into that and how that's been throughout medicine?
Yeah, so I have one child. We probably would have two if the pandemic had not hit, but that's just how life goes,
And that's
because
how life is.
that's just how life goes. There was
Yeah.
no having another child while I was a fellow in the middle of a pandemic. It just, and that's just trusting the will of God and saying, you know, so my daughter is now 8. She is in 2nd grade, and I had her when I was a medical student, and of course got to be a mom all through intern year and residency and fellowship and faculty. And my husband supported me all through training. And then when I became a faculty, he made the decision that he wanted to be a stay-at-home dad. And of course, we have a small business that, for things like speaking and writing and whatnot. So he has an MBA, and he runs our small business, but is also a stay-at-home dad, which is a huge support to me because, he handles kind of all the pickups and drop-offs and activities and house stuff, car stuff, and I basically get to practice medicine and write, and do cool things like this. So, I mean, we truly are a team, and my husband my husband did work. He went to work because his work provided income, and I get to go to work because I get to do the work, the meaningful work that I love to get to do. So it's a good balance for us. And it's been, I think, a little bit hard from an identity perspective for him in terms of his family and all of this, but he really is embracing what does that look like to be a stay-at-home dad. So, and it's so fun to be a mom. it's so fun to get to see. And just as you know, Tommy and Tyler, one day if you decide to have kids, how what a gift it is to watch this little life grow and evolve and become their own person.
Oh, it's
Truly the best thing in the world.
I yes, definitely want them working on the baby mama first, but we'll get there. I
Don't rush it. Most important step you'll make in your life is who you
Oh,
marry. So, you know.
guys, I'm so sorry. Hey, sweetheart, I am in a doing a podcast right now. Is everything okay? Okay. Yeah, if you don't mind, that'd be awesome. Yeah. Okay. All right. I'll leave you. Bye. Sorry, guys.
I could not be better timed. That's awesome. Well, I hope it's awesome. Is everything? I hope everything's okay. But
Yeah, I hope everything's all right.
yeah, I meant more.
Yeah, everything is fine. Well, my kiddo's sick and has to come home from school. But everything is still fine. I just have to figure out how to get my AirPods hooked back up to my laptop. Guys, I promise, Laura, it's usually not this hectic.
No,
Well,
that's okay.
no,
I can still hear you great. I don't know if
yeah,
that.
and I think we're also wrapping up on time soon. Anyway, I want to be respectful of Laura. If your time, you've already been so awesome making time allowances for us as well. So we could probably
Wrap
wrap
up.
it up soon. Anyway, yeah, so you can get to Ollie too.
Okay, yeah, well, that's the life of a parent, as Laura and I were just talking about. It's amazing, but then some things just come up and you have to go.
Absolutely. My daughter's getting over a bug, and yeah, we've been going through that all night. Wake
Yeah.
ups, and even at 8 years old, it like doesn't end, right?
It doesn't end. I think even when they're 21 and 25, and I say that I'm like 32 right now or whatever. But anyway, I don't think it ever ends for parents. I still call my mom about things.
I love that.
Yeah.
Wonderful.
Laura, there are literally so many things that we could talk to you about, and you are so wise. I think we have to have you as a guest again so that we could just dive into a lot of other topics.
I'd love that. Anytime. Be happy to come back.
Well,
Fantastic.
thank you so much for making the time to come talk. I am just always in awe of the things that you're doing and the things that you are, especially, I mean, selfishly, the work that you're doing with advocating for residents and medical training right now is just so impactful. But um, if if you need any more reason to keep doing it, besides Tyler speaking here, I can give you so many others that say every day how much they love and appreciate all that you're doing. So keep everything up that you're doing.
Well, thank you both. Tyler, Tommy, I'm huge fans of both of yours, and I love the work that you're doing. And so thank you so, so much for having me on here. It's been an honor.
Of course. Well, before we go, is there anything you'd like to leave our listeners with? I mean, you are full of so much wisdom. I would love for you to impart some wisdom as you leave.
Yes, I would just reiterate and echo that you can carve out the career that you want if you find yourself in a faculty career that's kind of you're lukewarm about, or you have this passion and love that is maybe you feel like it's outside or tangential to medicine. I'd encourage you to find a way to include that in the work that you're doing and to continue to carve out the career that you want, because I hope that we can have meaningful careers that are full of joy, and not every day is going to be just sailing and wonderful. But I really hope that you can hold on to your own humanity as you're navigating through this path and really carve out a career that is what you want it to be.
Laura, I couldn't agree more. And it really brings me so much peace in my heart when you talk about being able to carve out the life that you want, even if it's not something that has, a very concrete definition. I think that's also, I would hope that would be something that we can encourage more of all physicians, all people that are working throughout healthcare too, because at the end of the day, the one thing that patients really can't relate to for the most part is medicine. And so the more that we can, emphasize everyone that is in medicine to keep those other elements alive, you're not going to be the only one better off for it, but your patients are going to be so much better off for it too. So, as always, this is brought to you by the Hippocratic Collective. You can find this episode and all other episodes like this on hippocratic-collective.com. Until next time, stay human.
All right. Thank you, Laura.